We need HANS because there's no other organization like it in Canada and other countries, I believe, as well. We've been around for over 30 years and we've always been the support that people look to when they're looking for other information. We get such a range of phone calls every day, you know, people that are just diagnosed with something from their doctor or just looking for more information on alternative preventive medicine. And the reason that they call HANS is because they can't find that information anywhere else. And they know that when they call us that we're going to do our best to find the information for them. So it's also a friendship. Well, just this morning, one of our members had called to thank us. She was diagnosed with pancreatic cancer in 2007, which is a very aggressive form of cancer. Not a very good outlook, and in 2008 today, she is feeling great. She's cancer-free, and her doctors are baffled. And what happened was we put her in touch with Dan Burke from the UK, and he gave her some more options, and she's glad that she took those options, and we're so happy that HANS had a role in that.
I reckon HANS is necessary. We need it because there's very few other organizations which are helping the populace to know about, to understand about, even to be aware about alternatives to pharmaceutical health and mainstream medical health. I often call it a patient support group that focuses on natural, alternative, complementary, non-pharmaceutical approach to health. When people who are sick or their relatives and friends are sick, and it's a very lonely position, we all know this, it's a lonely position to be in. If you involve with HANS, you realize that you're not alone, there are others, and that in itself is so immeasurably important. So when people come to the conferences and the talk sessions, they find they're in the middle of a lot of other people who are in either a similar or the same boat, and that is terribly helpful.
I came across HANS for my own personal reasons when I was having digestive and health issues. HANS has this incredible library. So I used to spend hours a couple times a week just reading about diet, lifestyle, certain herbs, certain supplements that were natural that I could use to not only treat my digestive issues but to increase my vitality and health. I think HANS is important because as the public we need to constantly be educated. There's a lot of big businesses out there doing things in their best interest, and it's not always in the interest of the public. As well as now that some of our supplements are at risk of being taken away from the public, and this is things that are preventative, you know, supplements that can help prevent disease to help maintain health. I think HANS is there again as the advocate for the public to keep us safe.
And whereas the pharmaceutical industry and the health profession have lots of ways of disseminating information on the pharmaceutical and the mainstream medical side of things, HANS does a fantastic job of doing the equivalent dissemination of information for the non-pharmaceutical, the non-mainstream medical, for the alternative. And in terms of its magazine and its conferences, it does it not for the professionals as so much as for the lay public.
I'm really in favor of preventative medicine. I think it's in the best interest of the public, of the country, if we prevent diseases.
And on the scale of things, probably keeping healthy is more important than anything else.